Etienne at Clara Maass Medical Center, and we want to welcome you to our session today. So we are very sensitive to the fact that a lot of our parents and caregivers, I'm so sorry, a couple people still, yeah, there we go, that's much better. A couple of our caregivers and parents are, dealing with, the new environment that we're in, the remote learning experience, and, all of our children trying to cope with not seeing their friends and having to start off their school year from a distance. And there's a lot that goes along with that. And it's not only the school experience, but the fears and the challenges and the struggles just dealing with COVID in general and what that entails. And a lot of families have been impacted in many different ways, whether it be, heaven forbid, from the illness itself or from financial challenges or just the other stressors that are involved in not being able to see family and connect. So we know that bears a heavy weight on households and parents, and struggling to look for ways to best support their children and make sure that their environments are as healthy as possible, and that they are aware of whatever the signs might be that their children are really struggling and might need some additional help and support. So in this session, we are very fortunate to have with us Ms. Neysa Etienne. She is a licensed marriage and family therapist and a child specialist, and she works in our behavioral health division of Clara Maass Medical Center. And she's also a psychiatric emergency screener there. So she's very well experienced in this area, working with children and families and also with crisis. So she has been gracious enough to offer this session to our families and to give you some of the tools and resources and guidance that you might be looking for. And we also have some representatives from Nutley Family Services here as well. Fernando Vasquez is there. And for those of you parents that live in Nutley, that's a tremendous resource. And I know that we have some representatives here from Bloomfield Public Health. And I want to let you know too that the chat segment will be open, and I'll be checking that throughout this program. So if there's something that you'd like to ask, please feel free to put it in the chat, and Neysa is very open to your questions, and together we hope to get you all of the answers that you're looking for and hoping to get out of this session. So please feel free to do that. And at the end of the presentation, we'll certainly be opening it up again for you to chime in with any additional questions that you might have. So Ms. Etienne, I'm going to turn it over to you. Thank you once again, and we look forward to hearing all from you and all of your great guidance and wisdom.
Thank you so much, Desiree, for the lovely introduction. Now I want to thank everyone for being here tonight. I want to welcome everyone and just say, thank you for taking the time to join us and to discuss the reopening of schools and how, we can support the emotional well-being of the children during this transition and support the parents as well and staff. So I want to thank everyone for coming and joining. I want to start by telling you a little bit about myself. Desiree did an excellent job already of kind of starting that, but definitely, as she mentioned, I'm a licensed associate marriage and family therapist by background. I work for Clara Maass Medical Center as a mental health screener and as a child specialist in the Psychiatric Emergency Screening Unit, which is part of the emergency room. And what we do there, if you're not familiar, is we work with patients that come into the emergency room with any kind of mental health crisis, whether it be depression with suicidal thoughts, or panic attacks, or any kind of psychosis or mental illness. So we do see a lot of children as well that come in, whether they're coming in for school clearance because of something they may have said or done that seemed dangerous as it relates to mental health. And we see adults, we see all ages and all kinds of issues in our crisis unit. That's what I do here at Clara Maass. I do have some background in different kinds of settings. Have some experience in working with school staff and with children and families in a school setting. Also, I am a mother of two, so I have some personal experience with children. I have an 18-year-old who will be starting college this fall, and I have a 2-year-old. So I have some of that personal experience as a parent as well, that I bring to the table. So let's get started, and let's just talk a little bit about how we're going to be helping our kids and our families through this. So some of the highlights for tonight is we're going to touch on signs of stress, what's normal, what's considered normal stress reactions versus what can be considered red flags or warning signs of anxiety. We're also going to talk about some coping strategies and provide some tips for parents to help their children manage their emotions and their anxiety through all of this. And then we're going to also talk about the importance of self-care, and that's for a lot of the adults, the parents, and the teachers and supportive support staff in the schools. So that's all of the pretty much like an outline of what we're going to be touching on tonight. So some things to take into consideration. If I can move this over a little bit. So starting school or returning to school can be stressful or nerve-wracking during ordinary times. So from talking to staff in schools and, personally knowing myself and being a parent as well, the start of the school year is usually considered the hardest time. It's an exciting and stressful time for both teachers and staff as well as students. It's important that we remember and that we remind children that some of the worry and some of the nerves that they're having are expected and that they're a normal part of returning to a new school year. It's important that we don't automatically assume that and panic and go into panic mode that there may be a serious problem related to anxiety just because there is some anxiety there. So some of the things that are typical, right? Some of what is considered normal worries at the start of the school year would be worries about a new teacher, right? What the new teacher is going to be like, or who I'm going to, if I'm going to like my new teacher, is she going to be nice, or is he going to be nice? Grade difficulty, right? How I will be able to perform in the next level academically, increases in homework, and making friends. And making a team possibly if there's a student athlete. So these are some of the normal worries that children may experience when they're starting a school year. And then now, worries about COVID-19. That's a new worry, but actually it's a very normal worry. Now, unfortunately, this is our new normal at the moment. So we have to kind of take that into consideration, that stressful reactions during stressful times are very normal. And this means that you're human. This means that you're alive and that you're a human being with normal feelings and responses. And it's okay that right now we're not at our best. That's one of the things that we kind of focus on a lot whenever we're talking to anyone that's experiencing high levels of anxiety related to COVID-19 are, it's okay right now to not be at our best. This, that's expected. It's normal. It's actually very normal. So some normal responses or behaviors that we may see from children are, they describe experiencing the feeling of butterflies. We may see some clingy behavior, and that's especially even more seen with the younger children, right? We see a lot of the clingy behaviors, physical complaints, stomach aches, headaches, nausea, that can be very common. School resistance. I don't want to go to school in the morning, or sometimes it starts the night before, but starting to resist the idea of going to school. And express worry. Some children will be very verbal. They'll be very vocal about worries that they have and not wanting to start a new school year. So these are all very typical. We all experience worry or some level of anxiety. Everyone responds very differently to stress. So what we might see may look very different, but we all do have these same experiences. However, it's when the symptoms are overwhelming, when they're persistent, and when they're impacting everyday life, that they're actually considered more of a concern, that they're a red flag, that they may require additional attention or help from a professional. So again, red flags are warning signs. They kind of tell us that something is wrong. And they have three components. They're emotional, physical, or behavioral changes that we may see that indicate that there is a problem. And it's important for us to know also that children and adults display very similar changes. A lot of the things that we see in some children, adults experience as well. So we'll be talking a little bit about that. So you can see with physical signs, for example, physical red flags, there's headaches, there's stomach aches, there's sleep and appetite disturbances, and this means any change. So it can be with sleep, it can be an increase in sleep, someone who's sleeping a lot more than they normally did in the past, or it can be the complete opposite, someone who all of a sudden is having a very difficult time sleeping at night, or they're waking up at night very frequently. It could be nightmares. So any change in sleep could be could be one of the physical signs, as well as appetite disturbances, which could be, again, it could be whether you're eating a lot more than usual, or it could be where you're not eating enough. You definitely have a very significant decrease in your appetite. Fatigue and agitation are also some other examples of physical signs or possible red flags. So some emotional signs that we may see. We may see sadness, we may see anger, we may see anxiety or fears. We may see unfocused or poor concentration, unfocused students or adults, or poor concentration. And then we also may see unmotivated behavior. Someone who normally used to get up and do a lot, maybe that they don't have the energy. So it could be the fatigue, or it could be a lack of motivation. And then some of the behavioral signs could include crying, could include isolation, procrastinating or avoiding responsibilities, alcohol or drug use, increased arguing with friends or family, increased nerves or nervous behavior like nail biting, fidgeting, pacing. So these are some examples of behavioral signs. Now, remember, we all experience some of these from time to time. And as you can see, a lot of these are things that you can see in children and possibly in adults as well. And it's very normal to be experiencing some of these as it relates to anxiety surrounded around, what we're going through as far as COVID-19 and returning to school. It's when the symptoms are severe. It's when they are very intense that they may be more concerning. So if symptoms are extreme or excessive, if they're long lasting, if they're impacting the ability to function at home or school, so now you can't do things that you normally used to be able to do because of these symptoms. That's when we kind of are more concerned, definitely more concerned about the symptoms. So an example of that could be as it relates to long-lasting symptoms. Children typically, when they start daycare, right, when they start school for the first time, they cry. They cry, quite a bit. They cry pretty much every day, a lot of the children. And if you've worked in a school or if you have children, you may remember that usually the first month or two are very difficult. The children are adjusting and they're crying a lot. Once October, November, December come, children are pretty much adjusted and they're used to the routine if they've been going consistently to school. And, that's kind of what's expected. That's the norm. If December, January, February comes around and a child is still crying, the symptoms are lasting, all the way from September into, the new year, now that's a red flag. It's not typical for that to last that long. Usually they're adjusted by then. So for something like that, that's when a teacher or a family member, should have, that in mind and see and say, okay, let's have a meeting. Let's figure out what's going on here, what's causing, this child to not be able to adjust like most of the other typical, children are doing. So that's an example of long-lasting symptoms that may be concerning as it relates to anxiety that may be extreme with COVID. Again, it's expected that we're going to have some changes in our appetite. Some of us may have some, sleep disturbances, or sleep might not be exactly the way it used to be, especially as it gets closer to going back to work or going back to school. However, if it's excessive and if it's so intense that now I'm not sleeping all night and I can't function the next morning to take care of what I need to take care of, or if it's a child and the same, they can't sleep all night and they're keeping you up all night because they're not sleeping. That's when that it's a concern, when it starts to be excessive, or it's out of the it's way more than what we would think is basically expected for something for what's going on right now. So let's talk about some tips. We can talk about some of the tips we can give to parents, and definitely, for even for staff, for anyone who may be working with children or to some capacity, or helping children to adjust and going to be helping with, going back to school. So in general, planning or preparing in advance as much as possible is known to improve confidence and to reduce stress. It's important that, we explain to children in advance, again, as much as possible, what the school year is going to look like. Having information is what helps people to feel safe, and that goes for children and adults. When you're going to a doctor's visit, you kind of like to know in advance what that's going to look like. When you're going into a surgery, you want to know exactly what's going to happen. How long is the surgery going to take? What's the first step? What's the next step? What should I expect to feel like? As sometimes, we don't have all the answers, but definitely having as much information as we can, it's human nature that's going to help us to feel safer. So it's the same with children going back to school. Any information we can give them about what the school year is going to look like, it's going to help them to feel safer. Also, letting them know that plans may continue to change. And that's very important too, because knowing about potential changes in advance helps people to be able to adjust when the time actually comes. So having that heads up that, okay, this is what things look like right now, but things may change, certain things may change because this is something new for all of us. So having that heads up is definitely very good preparation, even if we don't know exactly how things will change. But at least there is some level of information or of a heads up. If your child is concerned, it's a good idea to ask him or her about a time that they had to adjust to a change, and ask them about what helped them to cope with it. A lot of times we want to kind of, fix things for children, and that's, again, a very natural reaction. We want to make it better. We want to fix it for them. But the more that they are involved in the process, a lot of times of the problem solving, the better that they kind of feel about the outcomes. So asking them and, letting them be a part of the problem solving, or the, trying to figure out how to feel better, what we can do to it to adjust, that's very helpful. It definitely is very helpful to them to be a part. So another tip is to help children to focus on the things that they can control, to help keep themselves safe. That goes for adults as well. If we focus a lot on the things that we don't have answers to, or the things that we don't have control over, that's anxiety inducing. So it does help to think about what we do have control over, and the things that we can do to try to keep us safe is hand washing, wearing a face mask, social distancing as much as possible. And that, focusing on those things is going to be more helpful than focusing on the things that we don't have answers to and cannot control. It's also, this is a, tough one, but it's very important that we assess our own stress levels as adults or as parents, and, our own levels of anxiety about school reopening, because we can pass that anxiety on to our children. So it's important that we're aware, that we kind of take our own temperature and see where we stand and how anxious are we. Because if we're very anxious, chances are our children are picking up on that. So it is very important that we do assess ourselves and how we're feeling. Children they're always listening, they're always watching, and they're always learning. So they're picking up everything, from the adults around them. Children also pick up on nonverbal messages. They pick up on fears, and that's not only children, that's, adults as well. There's a comedian, I can't even remember the name, and I remember there was like a bit in a stand-up where the comedian talked about how adults react to other people being afraid in the environment. And he said to his audience, he said, I bet you if two people just stood up and started running in fear, people would follow. Other people would just get up and start running and not know why. And it's very true, actually. That's human nature. So it's a very extreme and kind of a silly, kind of example, but the fact is that we pick up on fear. Children, adults, we all pick up on fear. So it is important that we assess our own stress levels, our own anxiety about what's going on. So school refusal. I think that this is something that we can definitely give some information on, because it's very common, and then we're probably going to see more of it now with COVID and returning to school now. It's important that it's understandable that this is very difficult for some parents, for a lot of parents. Not sending a child to school alleviates the problem at the moment. So that's why, because of that, parents allow children to miss school at times, because it does solve the problem at the moment. And a lot of times it's, I think parents don't realize that it's going to lead to more problems, right? We feel like it's a one-time thing, which ends up kind of snowballing. But it is important that, first of all, if the child is reporting any kind of physical symptom, headaches, stomach aches, that sort of thing, that they are seen by a pediatrician, and that any medical conditions are ruled out. Definitely don't want to ignore any physical symptoms. So it is important to be mindful of them and address them. However, and this is, the tough part, is that, the most important thing that a parent can do when children resist going to school is actually to send them anyway. And that's easier said than done for a lot of parents. It's really the best thing that we can do for the child. Not sending children to school consistently is actually counterproductive in the long run. So although it solves a problem in the moment for the day, it creates a bigger problem, and which is more difficult to resolve later on. It does, it does more harm than good. So some of the things that it can kind of cause is, number one, it reinforces behavior. So obviously, if a child, and with younger children, and this is for younger children and older children, but if a child knows that if they cry really hard, mommy or daddy, they're going to feel bad, and they might keep me home from school today. It worked last time. That's what happened last time. They might not even consciously be aware of that they're thinking this, but they are either they're consciously aware, subconsciously it's going on, but it does create that learning where they're learned that this behavior gets me this result, and it kind of reinforces the behavior. So now they're going to do it again to get that same result. Also, it can reinforce the anxiety. So if I'm afraid of going somewhere, and mom or dad or grandma, if I'm afraid of going to school and they don't send me to school, then that may mean that they agree with me. That is kind of scary, and it kind of can reinforce or strengthen that anxiety or fear. it also sends messages that avoiding situations that make us anxious is a good solution. So it's the kind of the message that's being sent to children to not, that to not face a fear. And, for some situations, that is a good solution, right? Avoidance, it can be, but, not under all circumstances. So we have to be really clear when we are teaching something like that. So we definitely don't want to just send that blanket statement or message to children that if you're afraid of something, you just avoid it and don't do it. And that's a message that can be received. And then the other thing is, that the more a child misses school, the more difficult it will be to get them back in the routine. So it just becomes harder and harder. Like I said, it's something that kind of snowballs and becomes, more difficult to address. I think that, one of the something we can really do when this is happening, and I'm sure schools, a lot of schools obviously do this already, but work with the family to find out what's going on, and it's probably really hard for a lot of the parents. It's probably something that we, as the parents, need a lot of support in, just as much as the child when this is happening. Okay, so another tip is to help children have healthy perspectives. So there's not always a right or a wrong perspective to have. It's not about right or wrong all the time. It's just different opinion, different point of view. So look at this image here. One person can see this image and see the silhouette of a woman, of a female, and then someone else can look at it and see the silhouette of a man playing a saxophone. So I'm sure I don't know how many people are logged in at the moment, but I'm sure it's probably split. Some of you see one thing and some of you see the other. And that's kind of how perspective works. It's the same situation, right? It's the same glass that has, that's filled halfway with water, but some people see it half full and some people see it half empty. So it's the same idea. So a perspective or a point of view, it can influence your mood and your behavior, how you feel and how you act. So it's very important that we're aware of the type of point of views that we have and that we're teaching our children to have, because it affects behavior, it affects their moods and their behavior. Having a healthy perspective or a healthy point of view helps to nurture resilience. And we're going to talk a little bit about resilience in the next slide, I believe, the next couple slides. Parents can model or be an example of practicing these healthy perspectives is what we would hope, is what would be best, what would be ideal. And here we go. So resiliency, we have here a picture of rubber bands, right? And rubber bands are very bendy and flexible, and they kind of snap right back into place. Sometimes no matter how much you pull on them, they typically just bounce right back. And that's kind of what resiliency is. It's the ability to bounce back from a negative experience or a difficult challenge. And we all experience things differently. We all cope and recover very differently. And a lot of that also depends on our personal resilience, how I can bounce back from something is very different than how somebody else may be able to do so. The good thing is, though, that we can all improve that. It's a skill. It's something that we can build upon. Our resiliency, we can build it with the right tools and the right support. And having a healthy perspective is one of those tools that can be used to improve the ability to bounce back. So as it relates to perspective, some examples of healthy perspectives are reminding your children, for example, that this is temporary. That's something that we can tell, our children, when they're upset about the way that, things are. For example, my 18-year-old who just graduated from high school, he was very much looking forward to not so much graduation or prom. He could honestly care less about that. That was more probably me that was excited about that. But he was really looking forward to going to college and playing, he's a student athlete. He wanted to go play, soccer, and, that's all changed. And so it's tough, it's very difficult for a lot of kids, a lot of these changes and losses. But it's important to just remind them that this is temporary. This is hard right now, but it's going to get better. It's not going to stay the same forever. Nothing is forever. Everything is pretty much temporary. So it's important that we remind children that this is a temporary state that we're in. Another perspective that's healthy that can help children is letting them know that they're not in this alone and that we're all in this together. That's another example of a healthy perspective that we can kind of provide to our kids. So another tip would be to help make sure that the kids are, that they're taking care of their bodies, that they understand, or that we understand at least, that a healthy body equals a healthy mind. So helping children to have good sleep schedules, that they're eating healthy foods, that they're getting the right amount of physical activity, that they're staying hydrated, right? And that they're getting sun and fresh air, that they're getting medical checkups, taking vitamins, that their screen time is managed. All these things help to support a healthy body. And then also if you have a healthy body, they do also help you with having a healthier mind. So taking care of the children's body, helping them take care of their own body. This is something that's very important for parents to be reminded of. And we should remember as parents that the examples that we set are very important. Adults should try to model what taking care of your body looks like. If we are telling children to go to bed early, that sleep is important, but we're up all night and we're not getting enough sleep ourselves, we might not be sending the message the best way that we possibly could. They might not be receiving it the same. If they see us taking care of our bodies and doing the things that we're asking them to do, then it's going to be more effective. Same thing with practicing the healthy perspectives. If we practice having a healthy perspective ourselves, then we can be that example for them. We can help them to be able to do that for themselves as well. So some do's and don'ts. Couple slides on some things that may be helpful and not so helpful when dealing with children and going back to school. And one of the first don'ts that I have listed here is don't downplay the seriousness of COVID-19. Children, they're very smart, they're very aware, they have access to a lot of information nowadays, and they understand that this is something very serious. So downplaying the seriousness of it isn't really going to be the most effective way of helping them through this if they're upset or if they're worried. Instead, it's very important that we be honest with them, that we provide them with only the necessary and age-appropriate information that they need. Again, information creates the feeling of safety. It promotes the feeling of safety. So we want to be honest with them. We don't want to downplay anything, and we just want to give them information that's appropriate for them to help them to adjust. Don't tell your children there's nothing to be worried about. Sometimes, most of the times, the intention is good. The intention, it's coming from a good place, and we're trying to help children, and that's something that we say a lot of the time to them. Statements like this, though, unfortunately, they can unintentionally dismiss their feelings, and so then they're not as helpful. Instead, acknowledging their feelings by just listening to them would make a much better have a much better effect, helping them to identify their feelings, especially with younger children and even some older children and adults. We have a hard time really kind of pinpointing what it is that we're feeling exactly. Validating your child's feelings and showing that you understand. Sometimes you just want to be heard. I mean, if you think about a time when you were stressed or upset about something or concerned, And sometimes we just want someone to hear us and feel like we're being listened to and understood and validated, and that's all. We don't really sometimes even need someone to solve a problem for us. We just want them to be there with us in that moment and hear us and help us to feel understood. Don't pressure children with formal or suggestive talk. Sometimes, and every family is very different. This is just, coming from some of the information that I've, been coming across and looking into. But, a lot of families, they may have scheduled, family meetings and that sort of thing, which is fine. That there's nothing wrong with that. However, casual talks as it relates to when children are worried about something or concerned about something, they tend to be very productive. For example, do you know what classes you will have this school year? Something very casual can lead to sometimes children volunteering even more information. So sometimes conversations don't have to be very formal, very serious, or very, scheduled. And sometimes we feel like that's the way that it probably should be or has to be, but it's not it doesn't necessarily have to be that way. Sometimes very informal talks can help you to gather even more information and be able to get your child to open up even more sometimes. Do prepare as much as possible in advance. Have children meet the teacher via Zoom if possible. Practice the walk or drive to school. Anything that you can do to kind of help children become familiar or familiarized with, going back to school. The more that there is exposure available to them, the more that things are kind of, familiar or repetitive, the more comfortable that children can feel. So if there's any opportunity to drive by the school and see, okay, this is where you'll be coming in through or leaving, and this is what your walk will be like. And again, it doesn't have to be formal, but any opportunity to kind of just prepare in advance is helpful to children. And then do talk with a teacher or a counselor in advance if you feel that your child may have a difficult time and needs some extra support. So if it's possible to reach out before the school year starts and give a teacher or staff heads up, that's a very good idea, actually. And sorry, one second, I got a pop up there. So if you can talk with staff, because there are some children that are going to have a more difficult time, and parents, they know their children. They kind of have, more than anyone else, they'll have an idea of what to expect a little bit more than staff will. And some children, for example, if they have already a history of other things that may put them at risk, like if they have experienced any loss or trauma, even prior to COVID or during COVID, if they have a diagnosis, if they have already suffer, excuse me, from anxiety or depression or anything like that, then they may have a more difficult time. And so then lastly, I wanted to talk a little bit about self-care and the importance of self-care. The practice, self-care is the practice of taking action to preserve one's own health, to preserve or improve one's own health. It's the practice of protecting one's own well-being and happiness. And self-care is essential for everyone, but it's very important for parents and teachers, anyone who has stress at home or work. So pretty much everyone. That's why it's essential for everyone at the end of the day. But self-care is definitely very important when you're taking care of others, because in order to take care of others, you have to be okay. You have to be taken care of first. So usually when I talk about self-care, I talk about the flight attendant instructions that are given prior to takeoff when you fly somewhere. And most of us have not been on a flight, unfortunately, in a very long time. But if most of us probably do remember. If you can remember when you get the instructions, if you're paying attention during any of that, the one thing that you might remember, hopefully, is it does, the flight attendants, they do tell you that you do have to put your mask on first, right? You put your oxygen mask on yourself before you put it on your child. And this is very important. You have to put your own mask on first, because you're of no use to anyone if you are not okay. If the parent is not okay, then they cannot help their child. So it's very important. Caring for yourself is often the best thing that you can do, not just for yourself, but for your family, for your children, for others in general. And it's not selfish. It's important to you, and it's important to everyone around you. So a lot of what we've talked about before kind of also, it also is relatable to self-care, as far as the things that are, that are healthy, things that are, tips for taking care of yourself, getting some sun on a daily basis, staying hydrated, prioritizing your sleep, and, drinking water, staying hydrated, eating healthy, honoring your body with healthy movement. So all of these things that are good for your children, for the children, are also very important for parents. And then, during all of this, one of the things that I usually talk about when I talk about self-care is the information diet. And basically, I think, a lot of us do get, so much information now that's, we have access to, whether it's direct access right on our phones, or, we have even, our emails come to our phones. Everything now is just right at our fingers, but we're constantly being provided with news that sometimes is also excessive and harmful. So it's important that we are aware of that, and that we're getting information that we need, but that we're not gorging and getting more information, excessive information that's actually not even needed, and is creating probably even more stress or anxiety than anything. According to psychological scientists, repeated exposure to traumatic images or from the media, or that leads to, could lead to mental and physical health problems over time, like mood or anxiety disorders. And so it doesn't necessarily even have to be COVID information. If we're constantly watching, or seeing things in the news that are stressful, or traumatic, it's definitely going to lead to more, more issues with anxiety. It could. So that's why it's very important that we take care of ourselves in this way, and what we are, in managing and kind of taking ownership as it relates to what we're watching, and is it helpful? Is it needed? And here is my information, my contact information. This is the information for the Psychiatric Emergency Screening Services here at Clara Maass Medical Center. The crisis unit is available 24 hours a day, 7 days a week, and we have a hotline that we utilize to obviously receive calls regarding crisis situations. But we also, that's my personal office number there if anyone has any questions. But we also take phone calls at that hotline number if anyone needs a referral, and they really don't know, where to go or who to call. You can always call a hospital near you, and that's if you're near Clara Maass in Belleville, that's the hotline for mental health crisis. And I just had some references here attached to the end of the slides. And I just wanted to thank everyone. I don't know if we have any questions or not. So before I thank everyone even further, I just wanted to definitely check in, Desiree, and see if there were any questions, any information I missed.
Sure, we can open it up now, everyone. If anyone has any questions they'd like to ask me, so please feel free to unmute yourself and chime in with your question. Yeah, so there was a question as to whether or not we'll be sharing the recording. So yes, everyone that's registered for this session, we will be sharing the recording afterwards. So if there's anything you missed, you want to refer back to it, we certainly will be sharing that.
Mainly because it keeps getting refrozen. Refrigerated.
So Neysa, you know, when you were mentioning some things about identifying changes in your child, you know, when they're going through some of these stressors, are there specific differences that you've identified with, because there's some children that are just very naturally social and they may be more impacted or affected by kind of being distanced from their friends and having that social connection than maybe some other kids who might be a little bit more introverted and might be falling into a habit of being even more introverted and maybe wanting to be on their computers or with the video games even more. So do you see any kind of trends or differences in how different children are responding to some of the stresses?
Yes, I mean, absolutely. We all have different, you know, I think I mentioned, you know, different kinds of ways that we respond to stress. So children, you know, it's the same with children. They have very different ways of reacting. So we do see some children that um, are more anxious and kind of doing things that they weren't doing before, whether it's a lot more hand washing, like even unnecessary hand washing. Um, there was someone that mentioned to me that their child was starting to like blow on their hands, you know, which was like a new kind of strange behavior. And it was related to, you know, the germs, getting the germs off their hands. So there's some children you're gonna see like, you know, some stranger sometimes strange new behaviors that weren't there before, and then there's some behaviors that are more that were always kind of there but now they're intensified. So a child that was always a nail biter, you know, but now you're going to see it in excess. You're going to see a lot more of it, you know. So there's that too. Children who were more, you know, to themselves and kind of introverted before, and now it's you can't get them out of their room. So you're gonna some of that you're gonna see, you know, we're seeing some of that, and you know, some of that I think it's expected. It's unfortunately normal to have a reaction at this point. You know, it's when it's, you know, obviously if it doesn't change, you know, if this child continues to blow on their hands and it doesn't go away, it is a good idea to have them maybe talk to someone, you know, maybe to see if, you know, they can help them kind of process their nerves about the germs that are on their hands or why they're, you know, how they feel about those germs and what's going on. So I think that, you know, it is normal to see some of these things. We don't have to necessarily panic because I think we've all probably even seen changes in ourselves. You know, it's just a matter of kind of, all right, if it's not getting any better, if it is getting worse, then okay, we don't ignore it. We kind of should maybe move forward with getting some help.
Yes, I agree. You know, I know, Fernando, if you're still on the line, I know we had Fernando Vasquez, he's here from the Family Services Bureau. And I was just curious, Fernando, if there's anything that you've observed or seen that we didn't tap into today that you think could be good information for parents to be aware of or be looking out for?
Or Fernando.
Oh, I think you're still muted, Fernando. There you
Is
go.
that
Okay.
okay? No, I mean the presentation was pretty extensive. I think that it is important that whether kids are going to be completely online or they're going to be part of a hybrid system in which they're in the building for a day or two out of the week. I think it is important for them to get out of the house at some point. Just because I know for me, I'm doing telehealth exclusively. I'm in front of the camera sometimes. I'm in Nutley Family Services, and I'm at a intensive in care agency as well. So sometimes I'm in front of the camera for like 12 hours, and
Wow.
it's
That's
taxing. Like it fries you just being in front of the screen like that.
Please,
I don't know how
That's like the most
like kindergartners are gonna deal with this. Like I don't know how preschool kids are gonna deal with this. The younger kids. So I think that taking breaks from online schooling is paramount to being able to get through this. And then, there's always, Nutley Family Services, our books are open right now. If, I have on my caseload I'll say about roughly five teenagers that are all experiencing some sort of anxiety around either returning to a building or returning to the hell that is online school. And then I also have like one college kid who's, not happy at all about having to pay full tuition for online university.
Yeah, I can understand that. Yes. What about, parents maintaining schedules for their children? I mean, have you found that, because both of you mentioned, having that time to kind of remove yourself from the virtual learning experience and having plenty of sleep and then getting time outdoors and maybe having time to connect with your family, whether it be online or however you're connecting safely right now. Have you found that there have been better outcomes when we try to institute to the best of our ability some type of schedule so there's still some regularity and it's not this free form experience that sometimes happens when it's virtual, when schooling is virtual?
Yeah, the worst, I'm not gonna say the worst thing, but it's when you give, kids do need structure. Kids need, they aren't the greatest decision makers on the planet. They need structure. They need a schedule. Sometimes free-form online schooling can be too much choice for them. They, especially younger kids, need to be on some sort of schedule. They need to, be up at whatever it is, 8 o'clock, 9 o'clock, have breakfast, online school, go outside, come back in, do online school, have a snack, go outside, come back in, you know what I mean? Or I mean, if it's raining outside, if it's a torrential downpour, okay, let's read together. Let's, if there is a parent that is at home, let's read together. Let's do art together. Let's wash dishes together. Let's do laundry together. Let's fix the house together. It's, online schooling has to be broken up. I've been, obsessing over the past few weeks over the educational system in Finland, and they probably I think they go to school for like 4 hours a day or something like that. They go to school less than we do, and they achieve way more than we do.
Yeah.
I think there's something to be said about if not like less is more, then at least breaking up the day into smaller, more manageable chunks, because
right, and making it so when they're in school or have that time, making it count, and then being able to step away to
if a 10-year-old can't be in front of a screen doing fractions for 8 hours.
Right. Absolutely. Are there any parents on the line that maybe would like to share with some of the other parents some of the best practices or things that maybe they've seen that they have found to be very helpful for their child, or very supportive of kind of this change in schooling and this online experience, and kind of being so socially distanced from their friends and family? Is there anyone that would care to share perhaps some best practices? I guess everyone's looking to you, Neysa, for your guidance.
I give so much credit to these parents, because I have, as I mentioned, I have an 18-year-old, and I have a 2-year-old. So I completely dodged the whole at-home learning situation. And, it's definitely very challenging to the parents that I speak to. I definitely hear a lot about, all the challenges. So the one thing is there's a lot of resources online. Looking online, I found so many. There's examples of schedules available to parents. There's examples of, different kinds of indoor PE, physical activities or exercises that you could do at home with children for all different ages. I think I downloaded some of that. Maybe I can send that over to you, Desiree, but they have so many resources available now, thankfully, on, on the internet that help parents through this, But I definitely agree with, I'm sorry, I'm terrible with names, and my screen doesn't have
Fernando.
Sorry, Fernando. I agree totally with Fernando about the importance of scheduling, especially with the young children. He's absolutely right with that. And then having some flexibility too. I think some parents probably, if they're not used to it, or if they themselves are very organized, they might want to be very strict on how they have their day lined up. And, sometimes children, they need a little bit of flexibility as well. And depending on their age, if they're older, they might need some choices, with teenagers, for example. If you tell them you have to do this, and this, and that, in this way, in this order, they might fight you a little bit more. Where if you tell them, okay, you have to read, which book do you want to read? You can pick, at least give them some choice, some options. Or, do you rather do your math first and then your English, and, give them some kind of choice in it. I think younger children are a little different in that, but with the older children, I would say is definitely you might need a little bit more flexibility, less rigidity with the whole homeschool learning.
That's a great point, Neysa, because a few of the parents that I've spoken with, parents are now put in the position of teacher, and it's very difficult. And a lot of them are trying to juggle working from home while they're trying to support their children in school. So they're keeping a lot of balls in the air, and it requires a lot of patience and organization. So I too, my hat's off to them. And I think you have a good point, to try to give the child some opportunity to weigh in on what that schedule is going to look like. And if they really love to read and it's kind of, they're having a rough moment or a rough day, okay, let's do the reading right now. And we'll do the math a little bit later. And just to be flexible. And I think we all have to be. And I think the teachers understand that too.
Absolutely. Absolutely.
If I can interject for a second, I also, I second that, what Neysa's saying. And I also think that if, it's a lot more difficult to make teenagers, if you have a second grader, third grader, it's a lot easier to implement. I'm not going to say easier. I know it's harder than the age, but it's a lot, it's more doable at the younger ages. And it's definitely more difficult once they hit adolescence or the teenage years. But with my parents, I found that they have more, it's easier for them if they're essentially modeling the kind of behavior that they want to see, like anything else. So if I'm like playing Red Dead Redemption 2 all day and I tell my kid, hey, you got to read Harry Potter, whatever, you can't play Fortnite, you got to read. He's going to look at me and say, well, you play video games all day. Like, what are you talking about? You know what I mean? Like, you're on your tablet all day playing like Clash of Clans, whatever. We also have to be an example. Like, if we want our children to spend their time wisely, we also have to break the god awful habits that we've all acquired during quarantine, in terms of eating garbage food, spending too much time on the internet, binge watching too much TV. Maybe letting the dishes pile up way too long, going on professional Zoom meetings in a black T-shirt instead of like a collared shirt, like I would have if things were normal. Those are all kind of, if we want to see that kind of behavior in our kids, we also have to model it in ourselves, and we have to remember that we are even if they're like, I hate you, dad, I hate you, mom, or whatever, like we are still their biggest influences because they're with us, especially now during quarantine. Like they're with us more than anybody else.
Absolutely.
I agree. They spend a lot of time with the family now. And the kids also, the teenagers need a little space too. Because whereas before, they got to spend time with their friends at school and share things that they may not want to share at home, they still need that little time to talk to their friends and, you know, share stuff that they may not want to share with mom and dad.
Absolutely. Absolutely.
100%, 100%. I guess, you know, I think everyone's trying to figure out what's normal. And before it was so easy because the day was carved out, the times were carved out, the class periods were carved out, the pickup, the drop off time was carved out. So we really didn't have to think about it. And now it's an amoeba that everybody's, you know, trying to kind of settle in on. And it's tough. And I think, you know, both you and Neysa and Fernando bring great points, you know, that some type of scheduling and regularity and something they can rely on.
Yes.
Is truly, I think, that what I'm getting from this, you know, having that, you know, some type of schedule, but not being so strict with that schedule that you don't allow for that flexibility to allow for those moments of stress and allow them to relieve themselves and step away when they need to.
Absolutely.
Yes.
Are there any other questions for Neysa or anyone have any comments or thoughts or questions before we close? Well, you did such a thorough job. You just answered all the questions, Neysa. But, you know, when the information is sent over to all of you, as you mentioned, Neysa's contact information is on there. And as Fernando mentioned, he's with Nutley Family Service Bureau, and there's many resources locally that can be of support to you and your children. So I think, you know, if there's anything that you feel might be a red flag, what would be your suggestion, Neysa, if someone just isn't quite sure and they're like, is this normal? Is this not? What would you think would be the first step? What would you recommend them doing?
I would say don't go on the internet. That's the first thing I would say.
Okay.
What not to do. I think a lot of times when we go online and we start looking up anything from medical conditions to mental health things, we automatically start to panic because the worst of all possibilities is what you're going to see pop up first.
Mhm.
I would definitely say, you know, if you have doubt, talk to a professional. If you don't have a therapist or you don't have a connection with your you know, school staff for your child, then there's a lot of other places where you can. There's a lot of programs. Pediatricians are good sources of, you know, referrals. You can get a referral for counseling through your pediatrician. You can call a local hospital to get a list of referrals to see what places you could go to in your community. You know, even your insurance, you can call your insurance and see, you know, what places are in network that can provide some level of counseling. But I think that it's definitely good to talk to someone if you're unsure, if you have any doubts. It's always better to just talk to someone to make sure that everything is okay. And sometimes you just need to hear that it's okay. You know, sometimes, like, again, some of the things that we're going to be seeing, some of the worries and the things that we're going to be seeing, sometimes once you hear that it's okay to have these worries, they kind of start to slowly go away a little bit. You know, they decrease somewhat because, you know, once you know that it's not as bad as you thought that they were, now you're not worrying about your worrying on top of what you're worrying about. So, but I would definitely say that there's so many resources, you know, available if you go online or you know, check with your doctor.
And the last question I have for you, Neysa, is, you know, how should a parent talk about the fact that they think their child might need some added support? Because I would think as a parent that might add a little stress to the parent. How am I going to say this? Is my child going to misinterpret this as me thinking something's wrong with them, or think, oh, my parent thinks I'm this or that, and put a tag or a label on it that's totally incorrect and appropriate. What would be a very healthy way for a parent to address their child if they do want to make an appointment and take them to someone to talk?
I think that's a good question. I mean, I think that a lot of times, it's my background is marriage and family therapy, so my background is very family focused, and so from my perspective is that when you go together and you say, what, as a family, we want to just see what we could do better to kind of adjust, because a lot of the times, honestly, it's not just the kids. Sometimes it's stuff that we're doing or not doing that could be making things better or worse. So
Yeah.
a lot of times, as a therapist myself, like, I don't really see children without their parents, especially younger children. As they get older, it's a little bit different, but in my opinion, parents need to be somewhat involved, because especially the younger the child, the more that they should be involved in the therapy or whatever support. So I would say that maybe, taking that approach of, we're both going to kind of, we're all going to figure out, how we can adjust, because, this is a difficult time, but not focus it so much on an individual. It's you that, that we're concerned about. You're the one that has a problem.
I love that. I think that's wonderful advice, Neysa. That's wonderful advice. Let's go as a family. Let's go together and see how we can all get through this together.
Mm-hmm.
And through that process, might identify things the parents could be doing differently, and everyone could be working together to have a healthier outcome.
Absolutely.
Yep.
Absolutely.
Well, thank you so much, Neysa, and thank you everyone for joining us. We appreciate your time this evening, and we look forward to hearing from you or seeing you again for future sessions. And feel free to, email Neysa or myself if there's content you are interested in seeing that somehow we haven't covered. We're happy to take your suggestions and redeploy additional support and workshops for you. So we are at your service, and we hope this information has been helpful, and we hope you and your family, your children, have a wonderful, healthy, happy, wonderful school year. We hope things can soon return to normal for whatever that means for everyone.
Absolutely. Thank you, Desiree, and thank you, everyone, for being here today.
Thank you.
Thank you. Good night, everyone.
Good night.
Night.
Good night.